You guys are welcome, and we are on our fourth question on head and neck on the MBBS Niger YouTube channel. How do you go about this? All right. So today we'll be talking about bleeding in scalp. That's our fourth question on head and neck. That's bleeding in scalp. Okay. Let's proceed. Let me turn my cursor to highlight stuff. Make sure you like our YouTube channel first of all. Okay. And I think I'm looking fine today. What's the question? What's the question that was asked? All right. We say that why will there be profuse bleeding in scalp injuries? Why will there be profuse injuries in scalp? Sorry. Why will there be profuse bleeding in scalp injuries? Okay. You should note the word profuse. It's not normal bleeding. There's much bleeding. And why would there be in scalp injuries? Okay, so let's proceed, guys. First of all, we'll look at the layers of the scalp. Okay, just note the layers of the scalp because as we proceed in this lecture, we'll be referring to the loose areolar connective tissue. Okay, and we'll also be relating to the periosteum. What's happening? Okay, we'll also be relating to the periosteum. Not really. We'll focus mainly on the loose areolar tissue. All right, so let's back up our points. First of all, we say that there is profuse bleeding in scalp injury. Okay, first of all, you confirm that okay, there will be profuse bleeding. Next, you give your reasons why. Okay, so there will be profuse bleeding in injuries of the scalp, and this is because the connective tissue of the scalp is dense, thick, highly vascularized. Okay, the blood supply is so much. Okay, the blood supply is comprehensive, or how will I say it? Okay, and many vessels anastomose in your scalp. Okay, first of all, the scalp is dense, thick, highly vascularized, and the vessels there anastomose. Okay, so moving forward, this is a bleeding, and you could see how profuse this bleeding is. The blood is gushing out so much. Okay, this is the bleeding of the scalp. So let's proceed. Secondly, you say that also the vessels are closely adherent to the connective tissue. We are still backing up our points. The vessels of the scalp are closely connected to the connective tissue. Okay, this too will cause profuse bleeding, but we'll speak about it in the coming slides. Okay, this is still a diagram just reminding us about the layers of the skull, and you could see are closely adherent to the connective tissue. This is a dense connective tissue. Okay, skin and dense connective tissue. Okay, they are closely adherent. Okay, next we say that because the vessels are closely connected to because they are closely connected to the connective tissue, we say that scalp injuries at this level, there will be profuse bleeding because first of all, we say that there is high vascularity. Okay, high vascularity, and the vessels there anastomose. Okay, this is just like repeating our questions. Okay, the first reason is there is high vascularity. Second reason is there's numerous anastomosis. Third reason is that time I was saying that the blood vessels are closely attached to the connective tissue. So that the inability of the blood vessels to retract due to their attachment to the connective tissue. Okay, and this will prevent retraction. Okay, the blood vessels are closely connected to the connective tissue, hence they can't retract because they are closely connected. They can't retract, and you know that our blood clotting mostly results from all those retraction, all this retraction and stuff. You understand? So once the blood vessels cannot retract, trust me, the bleeding will continue and it will be profuse. Okay. So this is another scalp injury, but this one is not really in depth like that. Do you understand? It's not really in depth. So with that, we have answered our fourth question under the head and neck series, and this question was talking about we should give medical reasons, okay, back up our reason why an injury to the scalp will cause profuse bleeding. And I hope you guys enjoyed it. Okay, so see you guys in the next tutorial. Remember, we have over 150 questions to make videos on under the head and neck, and this is just the fourth video. So trust me, you like to be here with us, okay, so that you could be able to pass your head and neck. See you guys in the next.